We want to talk about this, where it impacts our government and Congress. We are happy to be joined by Mississippi Democratic Congressman Benny Thompson, chairman of the Homeland Security Committee. Congressman, thank you very much for being with us. This is a tough initial question. This has now killed way more than the combination of 9/11 and Katrina. And here in the New York area, obviously, we have rolling deaths every hour. Is it perhaps too early to start talking about a rearview mirror investigation beyond memorializing documents and taking note of what's happening in real time?
Well, it's not too early, but we don't want to get in the way. I'm firmly convinced that the men and women who are out there every day doing all they can to address this pandemic will continue to do it. But I think as members of Congress, at some point, after we've gotten this pandemic behind us, we'll have to look at it. We'll have to see what went right, what went wrong. Did we have a plan in place to address it? And if so, did it work? And so I think members of Congress, just like we did with 9/11, we have to take a full view of the entire process, make it bipartisan, bring all the researchers from a health standpoint, from a policy standpoint together, and let us make sure that we put something in place that if this ever happens again, then we have the tools in the toolkit to address it.
Obviously, the administration is in charge. They're the ones that can marshal the resources, and the president of the United States is the president of the United States. But what about Congress? What sort of role did they play in all of this? And looking back, could lawmakers have sounded the alarm earlier? You guys were getting intelligence reviews and briefings about what was happening in China. The news reports were out. Could we all have sounded a louder alarm?
Well, I think some members of Congress conducted hearings. My committee, we conducted several hearings. We heard from the experts, and they all said, you know, first of all, you have to tell the truth. Secondly, you have to let the public know exactly what the possibilities are as we go forward in addressing this coronavirus problem. We didn't hear that. So for 8 weeks, we conducted hearings, we looked at things, we talked about it, did press releases, but the administration, for the most part, was somewhere between denying that this was a serious endeavor, or it might be just the flu, or it just might just go away. Unfortunately, it has not gone away. And here we are in the midst of the greatest challenge we've had as a nation in terms of this pandemic. And obviously, without pointing fingers too strongly at this point, because we have to address it. Hospitals in my state are online asking for donations for PPEs, asking for any assistance they can. Well, supposedly our federal government, with FEMA primarily in charge, should be addressing this. But we have a task force. Now we have the president's son-in-law who has no experience in health care, no experience in emergency management, making decisions that for 2 weeks, nobody really knew he was there. So I think at some point, we'll have to look at it. But again, let me just acknowledge those first responders who are basically putting their lives online every day to try to help us get beyond that. There have been some bright spots, but there are some spots that we need to improve on. So my objective, like the objective of other people, is to, at some point, not get in the way, but I absolutely owe it to the American people to make sure that if it ever happens again, we get it right.